Good evening, friends. I am Dr. Mhadeshwar from Kankavli. Today, I am going to discuss about pathogenesis of diabetes. Basically, diabetes mellitus is a metabolic disorder where there is a chronic hyperglycemia. That means blood glucose level is always high above normal. There are different causes why this blood glucose is high. One of the most important cause will be definitely deficiency of insulin in blood. Insulin is secreted by beta cells of the pancreas, and these cells, if they are not secreting insulin, or even these cells they are secreting insulin adequately, sometimes this insulin is not utilized by the tissues. There is a diminished or no uptake of glucose by different tissues. That is why even in the presence of normal or adequate or above normal level of insulin secretion by beta cells, the glucose level is always high, and this is seen mainly with the type 2 diabetes. Whereas in case of type 1 diabetes, where the beta cells are totally absent and there is no insulin secretion at all. This is seen mainly with the type 1 diabetes where there is a juvenile diabetes. In pediatric it is called as juvenile diabetes, and which is seen before the age of 10 years. And at the age advances, the deficiency again increases, and by the age of 25 there is an absolute or total deficiency of beta cells insulin secretion. And the main cause is always genetic and at the same time environmental factor. Genetics means on the chromosome number 6 there is abnormality, and environmental means there is an infection because of virus which causes antibody formation in the blood of this patient, and these antibodies they cannot recognize patient's own beta cells and they also kills beta cells. So that is why this is called as autoimmune disease. So here the genetic factor is abnormality in the chromosome, and the environment factor is an infection maybe because of virus or some other infection maybe because of bacteria also. Whereas in case of type 2 diabetes, the genetic factor will be there. Somebody in family has got diabetes, mother, father or brother, uncle, sister. There is a history of this diabetes in these other members. But environmental factors, they are not like this virus infection in type 2 diabetes and type 1 diabetes. Here the environmental factors will be obesity, especially central obesity, and physical inactivity, sedentary lifestyle, where the increased glucose level is there in spite of having adequate or above normal insulin, where the receptors on the tissues, especially muscle, skeletal muscles, liver and adipose tissue, these receptors they do not respond to the action of insulin, and that is why GLUT4 receptor which are there inside this tissue, they do not get activated. So even though insulin is there, glucose level is high, uptake of glucose by the tissues is not there, and this causes many complications because of high glucose level. So in case of type 1 diabetes, where there is absolute deficiency of insulin, of course the treatment will be giving insulin from outside, exogenous insulin. Whereas giving insulin for this patient of type 2 diabetes mellitus is not at all advisable. Here we will have to decrease the dose of secretion of, decrease the insulin secretion by beta cells, and this can be done by giving either metformin or increasing activity or exercise when the glucose utilization will be there by these tissues. There are other many drugs which can be given for this patient, but the most important factor in the type 2 diabetes is excess insulin with the insulin resistance, which can be corrected by giving metformin adequately and increasing physical activity. Thank you.